Human Metapneumovirus, or HMPV, might sound like something from a science fiction movie, but it's a very real virus that affects millions of people each year. Discovered in 2001, HMPV is a common respiratory virus, meaning it affects the lungs and airways. This virus is found worldwide and is a major cause of respiratory illnesses, especially in young children and older adults. Most people infected with HMPV experience mild, cold-like symptoms and recover fully. However, HMPV can lead to more serious complications, like pneumonia and bronchiolitis, particularly in those with weakened immune systems. Because HMPV is a relatively newly discovered virus, many people haven't heard of it. However, it's important to be aware of HMPV, its symptoms, and how to prevent its spread. Understanding HMPV can help you make informed decisions about your health and protect yourself and your loved ones from this common respiratory virus. HMPV spreads easily from person to person, primarily through respiratory droplets released when an infected person coughs or sneezes. These microscopic droplets can travel through the air and infect others nearby, especially those who come into direct contact with them. Imagine someone with HMPV coughing into their hand. If they then touch a doorknob or other surface, the virus can linger on that surface for hours. When a healthy person touches that same surface and then touches their nose, eyes, or mouth, they can become infected with HMPV. This is why it's crucial to practice good hand hygiene, especially during cold and flu season. Washing your hands frequently with soap and water or using an alcohol-based hand sanitizer can significantly reduce the risk of spreading or contracting HMPV. While anyone can get HMPV, some people are more vulnerable to severe complications. Young children, especially infants under 6 months old, are particularly susceptible to HMPV. Their immune systems are still developing, making it harder for them to fight off the virus. Older adults, especially those with underlying health conditions, are also at increased risk of serious complications. As we age, our immune systems naturally weaken, making us more vulnerable to infections like HMPV. People with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are also at high risk. Their compromised immune systems struggle to fight off infections, making them more likely to experience severe symptoms and complications from HMPV. Preventing HMPV infection relies heavily on breaking the chain of transmission. One of the most effective ways to do this is by practicing good hand hygiene. Washing your hands thoroughly with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating or touching your face, can significantly reduce the spread of the virus. Avoiding close contact with sick individuals is another crucial step in preventing HMPV infection. If you know someone is sick, try to maintain a safe distance to minimize the risk of exposure to respiratory droplets. Cleaning and disinfecting frequently touched surfaces can also help reduce the spread of HMPV. Use household disinfectants on surfaces like doorknobs, countertops, and toys to kill any virus particles that may be present. Finally, if you are feeling unwell, it's best to stay home to avoid spreading the virus to others. Rest, hydration, and over-the-counter medications can help manage symptoms and support your body's natural healing process.